this. So I'll just begin with a word of prayer, and then we'll dive back into some of the fun stuff here. So if you would, let's pray. God in heaven, we again thank you for the chance just to dialogue about mental health, and thank you again for just the opportunity to have this discussion, for just the expert panel here, for being able to glean some wisdom from that. And we know that these questions really do touch real people and real lives, and I pray, God, that would be really helpful for all of us as we navigate our own situations. And we pray that in Jesus' name. Amen. You know, one thing I will just mention before we get into the questions is, these panels I really love doing them, but at the same time, they're also challenging in that, sometimes when somebody asks a question, there's a very specific context to their question. So just keep in mind that, we're going to do the best we can to answer questions, but at the same time, if you should be looking to your own kind of doctor or counselor or person that can really get into your situation. I think that would be a best help. And again, maybe this can be an initial part of getting into that. We're going to begin with the most serious question we're going to have all morning. This is going to Kirsten. And Kirsten, this came in, so, hope you start sweating. When you're running and smile, is that a real smile or a fake smile?
I don't smile when I run. I don't talk when I run. There's usually a running buddy beside me, and he's instructed to not talk to me at all. You can ask Adrian about experiences of trying to talk to me while I'm running. So, fake smile, if there's one. There probably isn't one.
Very good. Nice. Thank you. All right, so as we get into this, again, we'll begin with these list of questions here that have come in throughout the series. So some of this is going to touch kind of a broad scope of the last 6 weeks of questions. We've been accumulating them. This first one, the question is this: please explain the biological/chemical imbalance to mental health, is the question. And kind of my paraphrase to that was that kind of looking at this, that mental health isn't just something in your head, but it really is something that's truly a physical issue that needs to be dealt with, just like a broken arm or a deep cut needs stitches. Mental health is a thing, and so how can we kind of understand that imbalance? So, Kirsten, would you want to start with that?
Sure. And as I alluded to before, the brain is very complex. And there are a lot of different relationships that are happening, a lot of things going on in the brain. And we really don't have a scientifically really well-studied or well-explained answer to why people get depressed or why people get anxious. We know more about the neurotransmitters and the chemical relationships between the brain, and we know that there are certainly things like serotonin, dopamine, norepinephrine, that different levels of them impact our happiness or our anxiety. But it's not as simple as measuring the levels in your body, and if you're deficient, then give you something that brings it up. It doesn't work like that. Interestingly, the medications that we use do help not only with necessarily the amount, but also the amount that's kind of floating around, not like the total amount in the body, but the amount floating around. So we have, like, for example, serotonin reuptake inhibitors, which prevent extra, serotonin from being uptake, so more floating around to use. Norepinephrine reuptake inhibitor, so there's kind of a combination. So we know that there are these chemicals floating around that impact mental health, but we don't exactly understand completely how they work. We do know that there are genetic predispositions to things, so depression, anxiety, certain mental health conditions can run in families, so there is genetic component, but we also know that if we just gave everyone something that would increase their serotonin level or their dopamine level, shouldn't they be happy? And it doesn't work like that, and there are sometimes medications don't work on different people. And so it's not, unfortunately, an easy answer, but we certainly do know that there are people, again, that are more predisposed to these illnesses. So there's that component, but we can't. It's hard, like blood pressure management or something. I can measure your blood pressure number. I can tell you if it's too high. I can give you medication. I can then measure it again and see what that medication number or the medication impacts the number. And it's just not that easy with people. If you want a little historical information, that again, when I was researching things, let me give you a little kind of historical perspective too, because mental health medications are relatively new. They really haven't been around for that long. And it was kind of an incidental finding when people were being treated for tuberculosis. There's a medication, INH, which is kind of the abbreviation, it's a lot easier to say, who they were taking that for tuberculosis, and they found that group of people kind of felt a little better. And so that's when they started researching things to look and see, okay, what medication can we use to help with that? Then MAOs showed up, and Prozac, actually, which is one of the first serotonin reuptake inhibitors, showed up in the 70s. So we have been dealing with mental health for a lot longer than the 70s, and so that's why you use your toolkit, right? Your fanny pack, doing other things, because medications were only really around relatively recently.
Yeah. Well, and to that, one of the, and I apologize going slightly off, this is an additional question that came in regarding medications, is marijuana. That's been such a hot topic as of recent, especially being legalized now in Oregon, obviously for recreational use, but it's been used medicinally for a while. Can you speak to some of that aspect of, is it actually helping? Is it actually hurting? Is it just depend on the situation?
So marijuana doesn't have an indication for treatment for depression or anxiety, and I would say it probably can increase both of those. There are other potential uses for marijuana in a medical setting. I think it's a little hard because when you look at marijuana, it has varying degrees of THC and the the CBD component, and so it is hard to compare types and strains and the effectiveness, and so I would. It's just hard to study too, because as of right now you can't really study it very well, though legally that may change down the road, but for mental health, I don't think that there is a role for marijuana in mental health.
Mm-hmm. And as far as even just jumping off of that into other substances, because I think this is one of the things I mentioned in a sermon was that anxiety being like number 1 or 2 issue for women, and then like number 1 or 2 for men. And but part of the issue is that men often are more willing to kind of, they don't want to go see the doc, they don't want to go see the counselor. So then, let's let's get some whiskey started, or let's start smoking, or let's do something else that makes me feel better. To what degree are we seeing? Is there anything to that as far as self-medicating through substance abuse or that type of thing?
So I think that that's a very common way to cope with a lot of the anxiety, depression, stress. It's not a healthy way to cope. Certainly has significantly more adverse effects than benefits. And so yes, it is used, but not to, should not be used, I guess I should say.
Not to a healthy degree.
No.
Yeah. Either of you want to jump in on anything with that?
I would jump, gosh, that's really hot now. I would jump in on the use of both probably marijuana and alcohol for anxiety. I see that a lot. It's very effective in the short term. It has a lot of long-term costs. And so if you are anxious and you use marijuana to calm down, you will instantly feel better. I always try and acknowledge that, because it's really hard. When someone is genuinely suffering and they're trying to find something that feels better, it feels better in the moment. As you metabolize it, people tend to have rebound anxiety that comes back with a vengeance. And so when you use a substance like that to soothe anxiety, and really anything that we do to soothe our anxiety that doesn't get to the root of it, it tends to work in the immediate, with the immediate suffering, but then it tends to come back. And what you end up having is something that takes on a life of its own, something that you started as a solution for the problem becomes a problem of its own that then has to be addressed in addition to the original problem. And so that's something I would highlight as far as using substances for anxiety.
Right. And that's where we need the fanny packs.
That's right.
So, yeah,
Pull out
Father's
the
Day's coming up. We'll get some
exercise.
fanny
So
packs going, right,
exerc-
Adrian?
I was going to say, exercise is an excellent choice for anxiety. And in fact, there are some people, sounds silly, but that carry around jump ropes. So when they start feeling anxious, when they start feeling like I need to start drinking as a thing, they go and jump rope. And it releases endorphins. It distracts you from that anxiety. And so, carry your jump rope around in your fanny pack.
Nice.
So I'll just add it a little bit around one thing that, Kirsten was talking about, just the causation of a lot of these things. There's a lot of correlations that we can determine. Causations are really hard. Like people that have TBIs or traumatic brain injuries are much likely to have addictive personalities. A lot of the people we treat for substance use, I would say an overwhelming majority have one or more significant TBIs in their past. And so what does that do? It's some sort of physical event that happened to the brain, but it affects the way the brain processes and thinks. And so there's a lot of different things that can correlate to that. And also on the marijuana front, we've seen a huge increase in substance use in Oregon and marijuana use. And what's interesting and kind of like was discussed too, there's a lot of short-term benefit for substance use. So it makes it addicting. That's what makes it attractive. Initially, it mutes pain. It reduces anxiety. You don't think about whatever has got you sad. Long-term, it wreaks havoc. Physically, emotionally, socially, financially. And then you end up coming and seeing me. Because we're not only dealing with the anxiety or the depression or the grief, we're also now dealing with a chemical dependence. And those are two different things. So now not only do you have the loss or the grief or the hurt, you're also now dealing with an addiction. And marijuana too, like what Kirsten's talking about, THC levels, it's insane. Like if you look at what you can buy, it's not what they smoked for years and years and years. Like you can go back centuries, and it was used very medicinally and culturally and religiously for as long as you can. As long as there's been men, we've always tried to look at ways to smoke something to feel good. It goes way back. But until now, the THC levels, you can push up to the 90s, which is really high, 90% versus in the 60s, it probably would have been more around 8%. And it's a psychedelic. That's a psychedelic effect, is the THC. And then the CBD has more the medical component, is what it sounds like, as far as pain reduction. And then there's things called dabs. It goes down a whole rabbit hole with marijuana. That's a pretty broad question.
It is, yeah.
I think marijuana today is probably not very beneficial medicinally at the levels and everything that it's at. And again, you end up having increase, we see people, short-term benefit increase, higher anxiety, higher depression, psychosis. So long-term, it's a bigger battle that we end up having to fight.
Right. And I think just to kind of move on now from this, but just to say that I think keep in mind that tobacco companies, as they're producing these now marijuana cigarettes and all the vaping tools and all this stuff, it is a multi-billion-dollar industry, and they're not in it to not make money. So they want to addict you. They want to help you make sure that you become codependent on this. And that is a battle that we just need to be really wise of. And, to any medication, a lot of times just doctor-prescribed medications can be very addicting. And so just being really honest about where are things at and building dependencies creates more issues. So thank you guys for sharing that. Next question. So I mentioned earlier, where do we start? If we're kind of having some different mental health issues, where do we start? The specific question regarding this was, if we have friends or family members struggling with mental illness, what are some first steps? So we'll start with that, and then there's kind of a part 2 to this that asks, what if they have said that they do not want help? Do I respect their decision to not get help, or do I still do something even if that possibly breaks trust and lets them down? So kind of a big two-part question. Where do we start? And then dealing with the more kind of personal side of things. So I want to jump in there, Brandon.
So this is a good question, and I like to think kind of back to just the broader what Scripture says, and 2 Corinthians 1:3-4 says, "Blessed be to God our Father, Lord Jesus Christ, the Father of mercies and God of all comfort, who comforts us in all of our afflictions, so that we may be able to comfort those who are in affliction with the comfort which we ourselves are comforted by God." And so when we think about friends and family who are struggling and hurting, and how do we help guide them, first of all, just the comfort and reassurance that we're there. Like this, it's a hard road to walk alone. And in fact, I just did a week-long training for mental health and law enforcement. And I had an individual on the very first day, she was just standing outside and she wasn't coming in the building. And just her anxiety about walking in to sit down for a training was keeping her from being able to walk in the door. And that kind of really stood out to me. And then when we were kind of thinking about this question, if I have a lot of a depression or anxiety, or maybe I'm hearing voices or whatever that is, and I want to go seek out help, that's a tough thing to go into your doctor. It's easier to go in there and say, like, I have a pain here, or I have this issue going on, versus coming in and admitting depression or anxiety or other things like you're hearing voices or addiction, things like that. But again, just thinking about Paul in Ephesians says, speak the truth in love. We want to be coming along beside our friends and family and walk with them. It's easy to just be like, hey, you should go talk to your doctor about that. And to some people, maybe that's enough. Maybe like, oh yeah, I didn't really think about that. It can also be, let's go together. Like, I'll go with you to your doctor. Help you get down there. Doctors they're like the open door, catch-all everything coming in. So they're the primary place where people seek out mental health first. Most people will go talk to their doctors about their anxiety or depression. Doctors, I think it's like 80% of the medications are prescribed by medical doctors. It is a big gateway because there's lots of other things that can cause depression and anxiety besides organic depression and anxiety. Like Kirsten listed a whole bunch of things. There's medical conditions. So it's a good place to kind of rule out what's happening. They can do blood work, they can do screenings, they can do all kinds of things. And so it's kind of a good open door place. It's less threatening than going down to see, like, let's go to the mental health program. They may not be open to that initially, but coming down to do that is good because there is a lot of stigma. I think there's been a lot of effort in our community to fight that with the Hearts for Health building. It was really designed, it has mental health, has physical health, has dental, has kind of everything as a way to kind of come into a building that's holistic, and so it's less likely to feel that. But I think the big thing is encouraging people by coming along with them, their friends or family, so that they're not alone. You're not just telling them to go talk to their doctor, whether you call with them, whether you go to the appointment with them to get them started. We'll help them, especially if they're already anxious. If they're really full of anxiety, the last thing they want to go do is go into a building and sit there and talk to somebody that they don't really know or aren't comfortable with. So having somebody they love and trust with them will make a big difference.
Awesome, thank you. Anything to add to that?
Go see Dr. Kane.
But I would say, we can start and then kind of start saying, okay, look at these other places that you can now find resources, that I can't, I can't counsel you, and these are these other things that are available, and can start with me and then go from there.
Mm-hmm. Well, and I would just ask, like, as far as that second part to that question, because that is like when you have a friend or family member who has come to you, or maybe even you've identified that, wow, this person does need some extra help that I just don't have in my toolbox. How do we deal with that? I mean, speak the truth in love. I like that. Being able to really be honest. But to what degree do we actually, or maybe should we be taking some steps for them to, help engage that beyond just like, even if they just won't get in the car and go with you to go, is there more to that?
And I think there's a place where we have to respect each other's autonomy. Like, we have to allow each other that levity to not want to get help. Because there is that balance of, like, we can force, not force, but we can have like an intervention, there we go. And sometimes those are helpful, but you run a high risk of damaging relationship.
Right.
And it is that balance of at what point does the potential damage of a relationship exceed, overcome by the potential concern. Now, if it's just like kind of low-level anxiety, depression, that is concerning. Is it worth damaging long-term relationship over? May or may not be. If it becomes, we're starting to think of suicide and more imminent kind of things, then that's probably worthy of risking that loss. And not every time you have an intervention or you do something that you really kind of get somebody to help, are you going to lose that either? There's a risk, and that's this balance that we all have to figure out. But it's not always. There's a lot of times where I've worked with families that they've done interventions and the person has been so grateful for it. There's times that it hasn't worked out good. And so it's kind of this balance that's more of a conversation when it gets to that point with providers that we can kind of sit down with you and kind of work you through, like, these are the potential benefits, these are the risks, what do we think is the best path forward? Because it does get to that point where it's hard, where we see worries of other people, they may or may not see it as worries, and they may or may not want to get help. And so we have to kind of learn to be okay with that to some degree, but also continuing to offer options, continue to be supportive of them through that.
Mm-hmm. Yeah. Well, and the old adage, people don't care what we know until they know how much we care. And, I think so much of that resistance to getting help or, having that confidence is about what kind of a relationship do we actually have with that individual. So that's going to, I think, determine a lot of how we're going to respond to them, because if they're trusting us with this sort of sensitive information, we hopefully have a good relationship with them, and we can lean into that relationship and say, hey, you trust me, let's go do this together. So that's good. Thank you. Next question. How does a person set boundaries with someone who is struggling with mental health, especially when you desire to help, but too exhausted to help, and their needs are too much more than you are trained and equipped to handle?
And I think we've covered quite a bit of this in the first question, but I think this is kind of that second part of, like, if you are supporting someone and they're having struggles and you know that it's more than you can handle, there's a lot of answers in that question, like having the humility to recognize where your skills or capacity ends, and being able to be truthful in love and grace with that person, and being able to share your limitations. Even in our professions, there are things that are outside of our scope. That I may care about you, I may want you to do better, but it's not going to be helpful if I try and do something I don't know how to do. And so being able to express your concern for somebody, I'm concerned about you, I care about you, and making sure that that's kind of the foundation of your conversation, and then being able to be truthful and honest about the limits of your capacity, being honest with yourself and being honest with the other person, and then pairing that with some of these resources that are being provided and that offer of support. Like, this is outside of, it's more than I know how to support, but here are some resources, and I'm willing to go with you. I'm willing to take those steps to kind of enable you to be able to take those next steps to take care of yourself, but not trying to do things that we feel overwhelmed or scared about. And then the other piece that I would say here is, if there's a difference between I'm feeling exhausted or I'm feeling scared for your safety. Those are kind of two different things. Like, if you're scared for someone's safety, they're turning to you, but you're feeling like, I'm really worried and I've got a bad feeling and I'm not sure, I'm feeling really uneasy. That might be a situation where you need to ask some questions about, are you safe? Are you able to be safe right now? So you know what next steps need to happen, because if somebody's not safe, that's going to look different than if somebody is turning to you and maybe wanting to debrief with you for longer than you can fit into your life or schedule or have energy for. Those are kind of two different things. And then I would also just put a plug in, periodically in our community, there's a class called Mental Health First Aid, and it's like a 4-hour class, but if you are interested in this topic, it's really helpful in terms of being able to differentiate between sort of what Brandon was talking about. Somebody's anxious, they're kind of low-level struggling, or maybe we have a safety issue. It's designed for lay people, and they actually they provide some tools in terms of how to start having some of these difficult conversations, and there's even some role play so that people can get comfortable, because a lot of times socially we're not really comfortable saying, we may have a bad feeling, but we're not usually very comfortable broaching topics like suicidal ideation. That feels like it's like really intrusive sometimes, or like, I don't know, I don't want to ask because what if they say yes and I don't know what to do. And so that's a class where it's just kind of a really quick overview of warning signs that someone might be having a mental health crisis versus just kind of a chronic struggle with mental health, and then what your next steps might look like and kind of equip with some tools to intervene.
Oh, it's really, really helpful. And anything to add to that?
I don't. That was really well said.
Yeah, thank you. One piece to this would be the boundaries piece. At what point, because boundaries are so hard, because there's this often like, our heart is we want to help this person, but like you said, not the tools and the toolkit, so we need to be trained up a little bit. But even I'm hearing a little bit of, I'm going to say, what is it, compassion fatigue.
Yeah.
Some burnout in this question where it's like, to just kind of self-assess, I guess, and say, okay, where am I really?
Yeah.
In being able to provide care, and do I have the energy? Do I have this? I don't want to say the time. Everybody has time, but no, I mean, people are busy, and there's a lot going on. Emotional stuff that's there for the caregiver themselves. So, anything to add regarding?
I would validate that setting boundaries is hard. So there's no recipe for easy boundary setting. It's a skill that is that you have to kind of be thoughtful. You have to know kind of the relationship, and you also have to, if you set a boundary with somebody, I think oftentimes we go in wanting to ensure there's going to be a positive outcome, that it's going to be well received, knowing that you do have a responsibility to be kind, to communicate thoughtfully, but you cannot control how people respond when you are kind and caring. You're not guaranteed to get the response that you want. And that can be hard. I did a Bible study one time called Women Connecting with Women, and it was really helpful for me in terms of conceptualizing one of the differences that they pointed out was the difference between bearing one another's burdens and each of us being responsible to carry our own load. And that can be hard to sort. So when you think about if somebody's gone through a catastrophic experience and they're in that acute phase following that experience, they're going to need everyone around them to kind of pull together to support them. If you are in relationship with somebody and they are maybe asking for more than you can give on a regular basis, then it can preserve the relationship to have a boundary setting conversation early on, because otherwise what tends to happen is that we get a negative association with that person. We see their name on our phone and we're like, oh, I care about them, but you feel tired when you
ignore.
Yes,
Yeah.
and so if you can earlier in that process, it prevents people from feeling like they have to maybe ghost someone or start making excuses to avoid them. Sometimes having those conversations, even though they're difficult, if you can do it thoughtfully, with kindness, in love, sometimes it actually preserves the relationship, because you can sort of rearrange things in a way that is healthier for yourself and for them. Because if you're providing support on an ongoing basis and they're not getting better, it's not working. And so if you sort of don't have that conversation, they may be less likely to get the support that they do need that you're not able to offer. So kind of thinking about that in those terms of, I care about this person's well-being, I want them to get help. And they're probably not going to do that without some nudge, if they're really struggling with mental health. So
Right. One book that has been really helpful for Becky and I, I'll just add this, is Lisa TerKeurst's book, Good Boundaries and Goodbyes. And so if that's something where you really struggle with setting boundaries with someone, or somebody who maybe is in that, where they need to set some boundaries, that is a super helpful book. She went through a really super difficult time and had a hard time setting boundaries, and she kind of wrote the book around that in her own personal journey, but one that I know personally has been really helpful. And so, I encourage you to check that out. All right, next question. Okay, so how do we handle shame and embarrassment if we have been abused or are nervous about getting help, especially due to the small town dynamic?
That is a deep question and a good question. Small communities are good in so many ways, but they're also challenging in so many ways. We know people, which is nice. There are people we all know and we can have relationship with, which adds a lot of benefit. But going and talking to somebody in a small community as well about our struggles, hurts that's been happening to us, abuses that have happened to us, to somebody that maybe we also go to church with. We see them at the grocery store. It's a little different than in a big community where you see somebody, that's the only time you'll ever see them, is when you go see them at therapy session, for example. You'll never run into them in the community because it's a large community. I think a couple things that came to mind are just some reassurances. As medical providers here and as a licensed social worker, we all fall under HIPAA and confidentiality. That's it's a word that's used a lot and described a lot, but I can't share anything. They can't share anything. When you talk in confidence with a therapist or your doctor, it stays in that space. I can't go share with anybody. If you are a client of mine, I can't, even based on my code of ethics, I can't come up to you and tell you hi in the community. I have to rely, if you want to tell me hi, I have to wait until you initiate that. So there's been many times I've been at parties, I have been at soccer games, I have been in all kinds of social events where clients of mine who have disclosed their whole life to me are there. I have actually had one introduced to me. Like, oh, this is so-and-so. I'm like, oh, nice to meet you. Like, I know everything about this person that they have disclosed to me, but I can't acknowledge I even know them. And so I think we can have some confidence in that. And also, just thinking about all the options, small communities, face-to-face, that is a challenge. Video or online is a great alternative as well for situations like that. There's a lot of online platforms out there now that is a good option for somebody that, I have a client right now that lives in Canada. I'm never gonna run into them, and so it's easier to disclose something to somebody that you're never gonna see. And sometimes it's even a little easier to disclose that when it's by video and not in physical presence. So there's really good options out there around this. And also just thinking about electronic health records came to mind. So everybody you see professionally, whether doctors or therapists, we all have an electronic health record. That's where your notes kept. That's where all your information's kept. Those are very, very tightly secured. At Center for Wellness, for example, we share an EHR with Winding Waters, and that's like Epic. So if you go to Winding Waters, you have an Epic account. And if I accidentally go into somebody, there's a record. Every time I enter a chart, there is a record of what I did, what I saw. And at any time, you can request that record. You can, hey, who's looking at my chart? You can know. So, and if I accidentally enter a chart, there's a whole process we have to go through, because that's a violation, and you have to go through that whole process. So records are very securely kept. And so I think that's another reassurance as we think about, if I disclose something and it's a small community, will it get out? There's some pretty good reassurances that your information won't. Not just for legal side, like on the HIPAA, that's a legal piece, but also just ethical. That's a pretty significant thing. 'Cause I've had lots of people share lots of really pretty powerful things with me that live in our community. And I see them on a regular basis in the community when I go about my day. And but those are things I think just to consider, because it shouldn't be a barrier if you have been abused and you need to talk to somebody about that and work through that. That shouldn't be a barrier. So if you're not comfortable in person, somebody in our community, then there's some amazing online options. Like BetterHelp it sounds cheesy. You get all the ads. If you ever looked at anything online, there's always these BetterHelp ads that pop up. Maybe just because I'm a therapist, I see them pop up a lot. But they are licensed therapists. They're not these cheap, underrated therapists. They're licensed clinical therapists. And you can pick all your credentials. You can say, I want a Christian, I want a female, I want this, and it populates you and connects you with a therapist that line up with all these values. So those are resources that are out there I think are very worthy of considering.
I would just add one thing to that would be, and this is thinking about our experience when we were fostering in Missouri, and I remember our first time into the DHS building, and I'd never had this thought before until that moment where we pull up and we're parked out front by one of the main roads going through this little bitty 2,000 person town, and I'm thinking, what are people going to think when they see my car parked outside the DHS building? The pastors, they're having problems or whatever. And I was just thinking about that here, and I'm actually not entirely sure where the DHS building is here because I haven't had to go yet. But even that can be a thing of I don't want people to see my car out there. And I was thinking, even if that is a thing where online doesn't work out, and there's the video stuff, is like, just practical things like maybe park down the street and then walk over, borrow a friend's car to go to the appointment. I don't know. There's some of those things you can kind of get creative with just even some of that stuff if you're just sort of hypersensitive to it.
I think just real quick on that note, it's
Yeah.
kind of nice, like at Hearts for Health, it's we do have mental health, physical health, dental in one building. You go over to like Winding Waters or the, what are you guys called now? I keep wanting to say your old name, but the medical hospital clinic, whatever it is.
Willow Memorial Medical Clinic.
That's the one. The therapists work out of the same clinic as the doctors. So you don't have to go to there. We don't have a true mental health building anymore in Wallowa County. You can go to Winding Waters, and they have therapists that operate out of Winding Waters. You can go to the hospital clinic and see people at the clinic. So you're going in, no one knows, are you there to see Dodie Beck or if you're there to see Kirsten? You go through the same doors. And so there's been a lot of effort in the community to help combat that. So it's pretty nice when you go show up, it's not evident that you're pulling up from the mental health clinic. So that's kind of nice.
Right. And thank you for clarifying that. And I would just say, like, if there is a hang up with the shame, embarrassment thing, is identifying where that's really coming from. Like, is that really just a deep insecurity that you have that really is kind of like, it's not really a thing, but it's a thing because of how you were raised? Because maybe you were told that going to counseling is for weak people, or maybe there is a layer of pride issue that's kind of like, oh, I don't really need help, and so it's just embarrassing to me if I have to go get help. And like, I would just encourage you to really check that with Jesus, and just like make sure that that's real, like your heart is good and all of that, beyond just like kind of maybe some of these other layers of needing help. Is don't allow Satan's tricks, his strategies to kind of stop you from getting any help that may need to happen. So, okay, all right, another question. So, to what degree of responsibility is on the person who is mentally ill to seek help compared to the family member, friend, or Christian in their lives to help them get help? So, first question. What is the person who's mentally ill? What is their responsibility? And then the follow-up to that is, do you have any ideas on how to motivate an already unmotivated, depressed person to do something or to take a step to get help?
I think we've touched on some of this already a little bit. I do think that taking ownership of your problem, mental health condition or whatever, is how you are going to make improvement. And so I would say it is the responsibility certainly of the person. But as we've touched on, you can't make anyone do anything. It's not going to be effective to make anyone do anything. So my hope is finding ways that you can encourage someone and empower someone to know this is something that they can do, that they can get better from. It's a process and takes time, but I guess being there to help support. But in the end, it kind of comes down to their decision and their choice. Touching briefly too, I think we always, if there's some imminent danger, it certainly becomes responsibility of others, hopefully, to help support that. But in the end, it's kind of theirs. And remind me the second part again, motivation, I think?
Yeah, like, is there any ideas of how, like, you did a great job giving these great steps beyond medication to kind of, in our toolbox to help with that. But if somebody's already just really unmotivated in their depression, in their anxiety, they just want to curl up in a ball or whatever, I mean, is there any ways of kind of helping them step out of that to begin the exercise or begin a walk or something?
Yeah, so I do think that beginning over and over sometimes are needed. So if it means going outside for 5 minutes, it means taking a 10-minute walk or a 5-minute walk. So starting slow, you're not going to run the Boston Marathon, right away, and having the expectation of exercise is important, but it doesn't mean run 5 miles the first time you exercise. It means get up and go outside for 5 minutes and kind of start slow. And so I think that encouraging but also being the person there to go stand outside with them for 5 minutes is important so they can see your support. But also means that you are taking care of yourself so that you're then able to help support them as well. So I think that one of the ways that you can motivate people is also by being encouragement by you following kind of what you are saying to do. So if I get up here and say, go run, and I never go run, it's not very helpful. So you being the way to say, I know it's hard, start slow, start over if you don't get, the whole process completed. It doesn't matter if you start over and start over and start over. Habits are one of those things that you have to do many, many times to develop a habit. And so remembering that is a way to again, help motivate. But in the end, it kind of comes down to them doing it. They're the ones that have to physically get up and go outside. But it's easier if you have someone around to help.
So we got to practice what we preach.
That's right.
So on that a little bit, like I have recently had some pretty severe depressed individuals, and it's all telehealth, which is a little harder to engage. And but for him, like the biggest battle is just getting up to get outside. It's not, once you're out, it's not too bad. So I just told him, all I want you to do is get up, walk outside, and just walk around your block, and that's it. It's my only expectation. And what's happened is like once he got out, and he walked around the block, he started feeling a little better, and then he'd end up going for a longer walk on his own. But the hardest thing is just getting out of bed, is that your brain's telling you, we hear this a lot, like, follow what your body says, listen to your body, which sometimes is good. If you're depressed, you don't want to do that. You want to do opposite of everything your body's telling you to do, which is isolate, stay in bed, eat a ton or don't eat. And so the biggest thing is just like, you don't have to run a marathon, but just get outside, step one. Get out of bed, step one, just like real simple tasks that are achievable. Because like some people, like I'll tell them, like statistically, if you are outside this many hours a day, which is true, but they're not gonna be able to do that. But if they can at least get up and get dressed that day, that's a good first step. Then maybe next week we can work on, now we're up and dressed, let's get outside for a bit. So it's kind of slow progressions as well.
Mm-hmm. Mm-hmm. So there's a book that's entitled Atomic Habits. I don't know if any of you read It's really good. James Clear is the author, and I would highly recommend, if you are looking for some ideas of how to build healthy habits, that book is just full of, and it's in the name, Atomic Habits, little bitty steps, 1% changes that over the course of time begin to change everything. And so I know Becky and I have applied that in different ways, and it's a really, really good principles in how we just can begin that journey. And that's a lot of what you're saying is, first you got to get out of bed. First you got to get your shoes on. First you got to just start down the driveway or whatever. And so begin these little steps can be really end up being big things.
I think too, like when people are really depressed or anxious, little tasks, just going outside. You look at all the micro tasks you have to accomplish just to do that. And it's very overwhelming to them to think about, like, well, to make dinner, that's easy for most people. When you're depressed, that's like, well, I got to go to the store, and then I have to mix this. And that's why a lot of people who are depressed eat really poorly, because it's just this packaged food that's really easy to eat fast. And so, like, helping them get through those little, like the atomic, like in that book, like these little small things. Helping them recognize that's a lot to ask them to get up, get dressed, put on clothes. Like those are, to them, seem daunting tasks. And so being patient with them through that process is helpful.
Yeah, good stuff. Thank you. All right. I have a couple more questions. This one's on social media, and so social media has impacted the next generation in a big way. A lot of social pressures, and young minds are being exposed to things that are hard for them to mentally and emotionally handle, which causes a lot of unnecessary anxiety and stress. What are ways to protect the next generation from these influences and have accountability on smartphones?
So I ended up doing some research around this over the last couple weeks for a different presentation that I was working on, and it was kind of staggering, the data around use of social media among youth and adolescents. I think it was the American Academy of Pediatrics cites, on average, teenagers are using their smartphones 9 hours a day. which I think for those of us who did not grow up with smartphones in our hands, that's kind of staggering when you think about the brain development. And one of the things that I was struck by is how much we don't know. This is a fairly new phenomenon. There's a lot of research going on. There's some research that's already come in. But in terms of looking at long-term outcomes, we have yet to see the full bounty of the outcomes of social media. I went to a presentation at the National Council on Mental Health on this, and they started out with kind of highlighting all of the positives around social media. And there is data to suggest, positives around social media, increasing connection, people being able to explore, identity expression and connect with other people of common interests. But when you think about 9 hours on social media, it's not just an issue of like, what are our kids doing? It's a complicated question. Like, what are our kids doing when they're online? How much time are they spending online, and what are they not doing during the 9 hours that they are spending on their phone? So all of the positive health behaviors that Dr. Kane has talked about this morning get displaced when we are on our phones constantly. And then there's sort of this second layer of like what is out there in the internet that our kids are being exposed to. And I would say it's not just our kids. Most of us, like I've got my smartphone, we've all got our smartphones. It is very difficult to kind of stay abreast of what is going on, even in your own little world, if you are not on social media. Like there's a lot of things that you miss. I have children who don't know when their sports schedules are if they're not getting those messages, sometimes even inside of social media apps. And so when I was kind of looking at what is the impact of that, there's a lot of controversy around it. There's been some studies that there was a large-scale study out of Duke University that came back and essentially said when we look at total screen time and the impact on your overall mental health, it is about as harmful as eating potatoes, which sounds really benign. And then there was another kind of group of researchers who reran their data and said, you guys only looked at total screen time. That was with TV, social media, everything lumped together. You didn't break it down by population. They reran data and they found that there are certain kids who are more vulnerable to negative outcomes with social media, and then what we are doing online makes a difference. So there's a big difference between doing your homework online versus being on TikTok for 4 hours online. And so I think that this is a complicated issue, and when I started looking at guidance has gotten over time a lot more complicated. When my kids were young, there was some blanket advice around like less than 2 hours of screen time for the day, and I could feel kind of confident as a parent that if I was doing that my kids were probably going to be okay. Our kids spend more time on screens before they even get home from school than that 2-hour limit. And so when I look at recommendations, a lot of times, a lot of organizations are going toward like screen and media plans in your family, like a family plan where you guys sit and talk as a family about your values, what's important to you, what are some positive things that we use our phones for, and acknowledging that. I think it's important as parents because we can really shut down the communication with our kids if we only come at them with all of the evils and ills and how terrible it is, even though we are worried. I think we have to acknowledge some of the positives and then talk to them about the dangers, and then it's going to be age specific too. I think the Surgeon General came out with a warning around social media and estimates that 40% of kids between the ages of 8 and 12 are on social media. That's before the technical age that you are supposed to be able to start a social media account. So all of the research that has been done to date around the impacts of social media has focused on that 13 and up age range, because that's technically the age at which you can have social media. But there's a lot of kids who are using social media and we're not even studying the impacts for those 8-year-olds. So I think as parents, this is a complicated issue. It has made parenting a lot harder, and the guidance is not simple. It's not a number. It's really a conversation in your family about your values, what you want your kids to be able to participate in, and then it's also that interaction with their development. What guidance you're going to give an 8-year-old is going to look different than what guidance and intervention you're going to do with a 17-year-old. And so I wish there was a quick and easy answer, but this is really just a huge conversation that we're having on a whole society level that I don't think there's an easy answer to, but it's something we do need to be aware of as parents and be involved.
Yeah, right. And sticking the head in the sand isn't helping.
No, and it's really challenging because a lot of us are not on the apps that our kids are on. And so it's almost like you need a little mini degree to figure out what you're even policing or trying to monitor. And so I think that's part of the challenge too for parents, is that our kids know more about like have to have my kids oftentimes help me figure out how to do things on my phone. And so it's really created a disparity for us as parents where we're trying to do the right thing, but like I may not even know all of the things that my kids are on the internet. So how do we have those conversations? And I think a lot of it boils down to our relationship with our kids. If your kids if something is off and your child is not doing well, we need to be talking to them and figuring out what's going on. And this may be a part of it, because this is a huge influence with our kids now.
Awesome answer, thank you. And anything else to add to that?
I would say potatoes come in chips or in things like potatoes. So think about that.
Was it a bag of Lay's potatoes or different kind of potatoes? Yeah, well, and I would just say, just what you were saying, that's really good as far as the, what do our family value? That's just a big question as far as like, how do we spend our time? And, from a standpoint of, do we watch movies together? Is that a family thing that we do over board games or something else? Or are we, I know for me, a lot of times I'm so tired by the end of the day that I don't want to have a lengthy conversation with my teenage boys, and so hey, let's watch Survivor, or let's go turn on the TV, and it's just like, it's exhausting, and so, kind of that vigilance piece, I guess, is being willing to say, okay, like this is important, and maybe it's not every single night, but, to what degree can I begin to integrate that into our family value and our family culture, is something that I know for me is important. I know for all parents, I think it's something we just got to be vigilant with.
I was just going to say, a lot of people I'm working with right now, and just for my own self, is like, what is our family mission value, like a business would have? And once you establish that, then anything that comes along, like opportunity-wise, finance-wise, or how we spend our time, is like checking that against our mission. Like, what are we doing as a family? What's our purpose? And does this get us closer to that? Does being on social media get us closer to what we're trying to accomplish as a family or not? And I think then that creates kind of a culture that the kids can start buying into. Does what they want to spend their time doing, how does that impact what we're doing as a family? So I think it's a good.
And I would also say whatever guidance we're giving our kids, we need to be modeling. Because, smartphone use is not just...
Practice what we preach
again? It's not just our kids that are on their phones. We're all subject to this, and I think we've all lost 90% of our attention span to it.
So something else I'll just add to this, and Becky actually turned this over to me, the book, The Anxious Generation, and I mentioned that in, I think, a week ago's sermon, but just giving you guys a book list, resources to go check out. That one does a really interesting job, and it's not a Christian book, but it is a research book regarding just the impact and even thinking beyond just the 13 and up generation, but even younger, getting down into the 8 and 10-year-old range. I mean, we all have these screens and these smartphones, and the capabilities of them are only going to be increased, and the speed of them is going to be increased. But so I guess the point of that is to educate ourselves on the real pressures that our teens are being impacted by. And I know it's fun to say we're the cul-de-sac of Oregon, and so are we really that different? I think that's one of the important pieces to this that I would say, from what I'm beginning to understand about the community is 20 years ago, maybe that was true. But the internet goes everywhere. And, they have fast internet here. And so you can do all of these things. And so I could just go back to that parent vigilance piece is, even though, yes, there is a difference in maybe the social dynamic in a smaller town, access to social media and all those things is just as much as if you're in downtown Portland. And so I think those are the differences where, it's cute and quaint in Enterprise, but there's still some real dangers that we need to be just aware of and be vigilant toward. So anything else to add to that? All right. Okay, last question here, and this one's a toughie because I did a sermon addressing self-harm and suicide, and so I think this one is a question maybe coming out of that, would be regarding suicide. How should a person deal with quote-unquote revenge suicide? So I take that as, somebody has committed suicide, and they, in their note, they named that person, or they had a situation where, they were blaming you, and then, bang, completed suicide. How does that person now deal with their own grief in that? And this is tricky. And so I would say I have a few kind of bullet points to that question, and please feel free to jump into any of this. But I would say, first, allow yourself to feel grief, because there is a reality that if you just ignore the situation of somebody blaming you for this level of pain and grief, that's very significant. And so the feelings of shock, anger, guilt, sadness, confusion, and a whole host of other things is going to be very natural in that process to experience. So I would say allow yourself to feel whatever it is that you're feeling. Next step, seek support. And we've just kind of laid out for us some good steps. And I would say, pastoral counseling, therapy, are great places to start there. Because you got to talk it out. It has to be shared. It has to be expressed in some verbal capacity. You don't want to be stuffing those feelings. And then I think it's also really important to avoid self-blame, because as we think through what we've just been talking about, just as we cannot physically force somebody to go on a simple walk down the road or back, we cannot force somebody to eat healthy. We cannot put ourselves in that situation where, yes, maybe we could have said something different. Maybe we could have done something different. But the reality is that their actions are still their actions. And we cannot bear that burden and responsibility. They have responsibility for their actions. And so I think if you're struggling with those feelings, understand that, again, that's normal, to not be blaming yourself, those things, but it's crucial that we're understanding that we're not in control of somebody else's actions, and so therefore you cannot blame yourself for what they have done. And so I think educating yourself on even that mental health piece with suicide, revenge suicide, understanding how the brain works, I think is really important to this too. We just had our conference just over the weekend, and it was Friday night and Saturday, and it talked a lot about brain development, particularly in adolescence, actually even in utero to adolescence to then teenage years, and how that brain and trauma and all of that stuff begins to impact. And so oftentimes we can become targets when we haven't actually done anything but try to help. And why is that happening? And that's so understanding how the brain works and why that's there. Really, there's often probably a lot deeper issues that are at play that's going on in those situations. So I'm sorry that has happened to people. It does happen, and hopefully that'll be maybe some steps to take in processing that. Anything to?
This is a hard one to talk about at a global, kind of a broad spectrum level. That's a really deep question. And it happens. I work with clients that's happened to them. I've been a victim of that in my career. I work with people who don't do well. We don't always have 100% success. Talking to people is going to be really important. And so if you are struggling with that, definitely reach out to a clinician or to your doctor. Reach out to somebody, because it is a process to work through. It's very individualized based on your understanding of suicide, who they were to you. There's a lot of dynamics in that but it's important to work through it. You don't want to just ignore it and shove it down. It's definitely worthy of working through.
Mm-hmm. Yeah. Anything else? Okay. All right. Well, I know, looking at the time, we are pretty much out of time as far as additional questions goes, but I would encourage you to take these cards. If there's more that you want to follow up with, feel free to write them down. Maybe we can do some email responses, and that would be a good way to follow up from this from this morning. I'm just really humbled and thankful for you guys to come and share your insights and wisdom and experience with this church, and that we can be a light in our community and maybe be a little more equipped with our fanny packs or toolkits, I guess, to be able to do that. I would like to close with a word of prayer, and then we're dismissed for the morning. God in heaven, we thank you so much for this time together. Some really good questions, tough questions. Lord, we just pray that if anything that we have spoken that is out of turn and not related to your good word, Lord, that you would allow us to forget and any of the possible bad advice. But God, I do pray that if anything has been overly helpful, that we would begin and know how to take action and process and think through these things. We know that it's such a delicate issue, and that each of us, maybe on some degree, have felt the pain and the grief of mental illness to deep degrees, to either just our own small, light anxiety and depression issues, to severe things. God, we surrender them all to you. We know that you are the God who is in control, who loves us unconditionally, who will meet us in our sorrows. And God, I pray that you would just help us navigate any of this stuff we have to go forward with. Thank you for allowing this series to be so helpful for so many. And I pray, God, again, a special blessing on everyone that's been here, that we would be able to take this and be lights in the darkest corners of our community. We love you. We thank you. And in Jesus' name we pray. Amen. Can we also get a hand for the panel? You guys did a great job. Thank you so much.